force to look at just these very issues. How do we prevent, I just cannot underscore that word enough, prevent and sometimes intervene or even treat families that are struggling to keep their families in a good, safe, thriving place. So with Senate Bill 1517, we have spent 2 years and we have concluded our support will provide us an infrastructure to move forward on coordinating services, trainings, awareness activities, and really make best use of the resources that we have in Oklahoma. Oklahoma has a long, wonderful history of implementing evidence-based practices. Unfortunately, as the years have gone on and we've had tough budget years, we've seen those services maybe erode, particularly, and I can't underscore this enough, even though I'm sitting in a metropolitan area, rural Oklahoma is struggling for services. Families can't travel counties away to receive a 45-minute intervention. Virtual help is good, but it's not always perfect. And we know the power of being with someone physically. We've endured isolation for 9 months, and we know how hard it is, even if we have all the resources and love and attention we can imagine. Just not being physically with those that we love is very, very hard. And sometimes we need a trusted person to hold our hand and walk us through. So I want to give a particular shout out to rural Oklahoma and just say, we hear you, we see you, we know that you need services. So Oklahoma may have some unbelievably rich services in practice. We don't have enough. And we need to build back what we may have had 10, 15 years ago and get back on track. I want to point your attention to this graphic up here. And while you may not be able to see all the details, page 27 of the report, I want to assure anyone and everyone that's listening today that you had better find a place for yourself and your organization on this graphic. Because if you don't, we made a mistake. And we want to get you on the graphic. Every role needs to be filled by individuals, businesses, faith communities, educational centers, nonprofits, you name it. Everyone should find a place for themselves and the entities they represent and their sphere of influence up there. So really what we tried to construct was a method so that if a local group wanted to learn about a best practice, they saw a need in their community, they could figure out where to plug in and seek assistance. Whether it's, I need to connect with a wider group that may have an answer to this, I just want to know what model we should be looking at and go across the country and tell me if you've ever done this before. How much would it cost? Who can help us with money? So we wanted to create a system so that the individual, the local advocacy group, a nonprofit or a service provider or a professional can find themselves, plug themselves in and be a participant. In this last year, what we really want to strive to do is reach out at the local level and to the partners that weren't named on the task force specifically. There were only 17 named members. Now, we had a lot of interested stakeholders and we invited people to the table. We had some unbelievably dedicated people to work groups, which is great, but this is an area that's going to take every one of us, not just a few, every one of us. So we'll spend this last and final year in reaching out and figuring who we missed, how do we plug you in. We have two very important structures that we have incorporated into this graphic and into the work. And one of them is the state advisory team, which is a wonderful, wonderful group that works with the systems of care out of the Department of Mental Health. I want to just tell you the Department of Mental Health has really led the way, in my opinion, in two areas. One, of course, in providing treatment services for anyone who's had experienced trauma. It's their bailiwick. It's what they do really, really well. But the thing that I think they've lifted up and do better than any of us is ask consumers what they need and how they need it. They don't go and pick a program, bring it to you and say, this is what you need, be healed and move on. They ask and they answer. So I just want to say we're all trying to follow that model. So their state advisory team will be a significant part of this system, as well as a subgroup of that group, and that's the children's work group. And so the Children's State Advisory Group. And that group will also provide some unbelievably rich opportunities for us to come together and continue this work after the task force is disbanded. So this was not an effort that will die. It will continue on in a public and a private collaborative. And we've already, I think Dr. Hayes Grudo is going to talk to us about an opportunity that is sitting at her university. And so you can see the coordination that's already happening in the partnerships. So we're very, very excited. The future you should see awareness campaigns, services, training opportunities, be better coordinated and offered across a wider spectrum. So if one entity is bringing in a great speaker, all of us should be able to avail ourselves if that's something that is possible. So in the end, I just want to say that if we've learned anything through this work, whether it's been with this task force or just in this work in general, nobody raises children in a vacuum. No one raised a child by themselves and that little child turned out perfectly. We've all had help. We've all had help one day or the other. Some days we're the helper, some days we're the helpee. We have got to normalize the idea that we all are part of raising all children, especially in this state where we are so resilient and we're so kind and so loving. So with that, I'm going to turn it over to Dr. Hayes Grudo.
You're still on mute, Dr.
Okay, I'm unmuted now. I want to thank you, Regina and Nicole and Steve and others from the Parent Child Center for hosting this. I'm sorry I'm not there, but I'm staying safe. And I want to thank my co-chair, Annette Jacoby. She is probably too modest to brag about our state departments and agencies, but one of the take-home lessons for me during the past 2 years was how incredibly dedicated and talented the folks in our state agencies and departments who provide services for children and families are. Is it not their fault that our families are still struggling? It is just a big job. So one of the take-home messages we have from 2 years of monthly meetings is the importance of leveraging the resources that we do have through communication and coordination.
Dr.
At each of our tests.
If you can stop sharing your screen, we still see the image, the larger, stop sharing your screen at the bottom.
Happy to. How's that?
Good.
You don't need to do that anymore, right? Now you can. Is that better?
Yes, thank you.
Okay, so we learned what we need to do is take advantage of all the programs that are currently in place and use them as our building blocks to build new programs, but more importantly, to make sure that people have access to programs many of us didn't even know we had. In each of our monthly meetings, at some point, jaws would drop and we would look at each other and go, did you know that they were doing that over there? Education, health, mental health, human services. So the first thing we learned is that we really have got to do a better job coordinating, and that should not be in one department, but it might be helpful if it's at a more independent outside group that can have some independence and objectivity about how to connect across the different barrier lines that exist between state departments and agencies. The Casey Family Foundation had been consulting with the Department of Human Services around this time with Seesaw and the State Advisory Team, and they came up with a plan and funding to hire this full-time coordinator. So we have had a half-time coordinator located in our center, our research center, the Center for Integrated Research on Childhood Adversity, for the past 3 months. And starting in January, we will have a full-time coordinator to help the task force during the next year pool together our resources, develop a clearinghouse of information, a website that can help people connect, and also to take advantage of programs that are going on right now, like Project 180, which is described in the report, and the Hope Centers that Secretary Brown, the Department of Human Services were able to use CARES Act money to pop up basically centers that could serve as prototypes for local service centers, combining different kinds of support programs for children and their families. So we have a number of opportunities that we want to test. We want to do continuous evaluation, look at success metrics, what is working, what are our stumbling blocks, how can we hone this process during the next year so that by the time the task force is officially completed, its 3-year mandate, we have some real specific recommendations and advice and the basics for a structure that can be sustained. I want to say one more thing. We have a history of resilience in Oklahoma because we have a history of adversity. What this means is that we're often, though, chasing problems. We're putting out fires. We're not doing the prevention work or the universal coverage that we know is what will help all children develop those muscles for resilience so that whatever happens during their lifetime, they have the capacity to respond flexibly and with strength and with support. So we know that we need to build relationships and resources that all children have access to, not just our most vulnerable, although we're certainly can continue to be focused on meeting the needs of those most in need. We want this to be something that every child in Oklahoma feels valued, treasured, supported, and nurtured so that we develop a reputation for resilience in Oklahoma. No matter what happens, we will thrive. That's our goal. I think we're open for questions.
No, Regina, yeah. Introduce yourself.
Good afternoon, everyone. I'm Regina Moon. For those that have not yet met, I'm the CEO of the Parent-Child Center of Tulsa. And I was asked to very briefly, very briefly describe how the Parent-Child Center of Tulsa plugs into the information that you've just been hearing. So since the task force was created in 2018, the Parent-Child Center of Tulsa has been involved in this collaborative effort to analyze, mitigate, and to prevent the impact of trauma and adverse childhood experiences throughout our community. In fact, this most recent work with these folks really layers on to the 3 decades of prevention work that we have been doing in the area of child maltreatment. This year in May, we marked our 30th anniversary of operations. So this was a project that we were very pleased to be able to connect with. So our staff utilizes evidence-based prevention and treatment services focused on supporting at-risk families who have been impacted by trauma, by meeting the needs of new parents, say in hospital settings, by teaching effective parenting skills via telehealth these days, rather than through in-home visitation at the moment, and just helping caregivers in general build positive relationships. When we do all of those things, we are building child health and well-being. So in addition, we're equipping parents with the tools they need to build resilience of their own and to also be loving and nurturing parents, as our vision statement expresses. So this multidisciplinary coordination and collaboration is a primary focus here at the Parent-Child Center for all of the services that we deliver, and helping families get connected with the resources they need to build agency and to foster hope in their lives is really at the heart of our mission. So we, along with the other members of the Trauma Informed Care Task Force, recognized that trauma-informed practices across all child serving systems in Oklahoma is necessary and vital to help children overcome and really recover from those adversities they've experienced in their early lives. This is why we were making this work a priority and why we were so excited to be part of this team that you've heard from. So I want to assure our guests that it is our sincere wish to continue to support trauma-informed care practices across the state, and that in the future, we enthusiastically reinforce our commitment to any efforts or recommendations that the task force may make. We look forward to a bright future of working in the best interest of Oklahoma's children. Thank you.
That concludes our speakers, and so if those present have any questions or whatever, we'll be able to entertain. Yes?
You talked about a website. Do you have a timeline on when that might be up and running? And in the meantime, for folks who don't know about any of this and are hearing about it now or read our stories, where should they go or how should they get in touch with folks doing this to get involved or to find services?
Annette, you want
Boy,
to?
that's a great question.
Yeah. I'm going to let her address that since they've deep in the trenches.
So there is no timeline for the website. So this task force was provided no resources, so we don't have any funding. What Dr. Hayes Grudo has been able to perhaps secure, along with partners, is assistance from Casey Family Programs, and we're hoping that that is a task that we'll be able to conclude before the end of the year with their assistance. I'm not speaking out of turn, right? But
No, that's absolutely.
okay. We have identified that there is a tremendous need for people to be able to easily access information, whether it's just education about trauma, or if you actually need some very specific help. Right now, I think one of the best things to do is to contact 211. There's a very long list of services and a person who can assist you, and they're statewide. That's the easiest answer I have. Now, however, sometimes that can be frustrating because the list of what they may provide you is very long, and you're going to have to go through it and figure out what fits you best. What we have discovered is Oklahoma has a lot of different websites and platforms. Each agency often has a services tab or kind of a section, and you could spend all day going to the Department of Health, the Department of Mental Health, Education, different nonprofits, and kind of seeking out services that way. That's one of the reasons we really have seen this need for a platform. I will say Be a Neighbor, which the Department of Human Services stood up in the past year, or maybe a little more, is, I think, a wonderful basis. And that may be something that we grow or ask to have grown. Right now, they have some very, not limited, but they have limited issues that they're working on and trying to add to that database. They don't have everything, and they're constantly working and evolving that. But I do think Be a Neighbor is another place that I would say 211 and Be a Neighbor for statewide services. But again, if you're in Kiowa County, you're going to have a really probably a fairly limited amount of services to look at. And you might be best to look for a local nonprofit who can walk you through what's in your backyard. We have really come to the conclusion that it would be a great idea if there was a website for professionals and a website for those seeking services, and make it easy and perhaps split them. Even as a professional, if I wanted to know what training was going on right now for, I don't know, the legal community, I might start with the Bar Association, but there are a myriad of trainings across the state where an attorney can go get really great training and get CLE, right? But where do you know to go look? Wouldn't it be great if you just Oklahoma Trauma Informed Care, blah, blah, blah. Would not be the name. That's not a very attractive name. But if you had something simple that you could look at and then go find everything on a calendar, that's our goal. Sorry, long answer.
Did you say you're hoping to have funding for it by the end of this year or by the end of next year? So by the end of when the task force dissolves?
We're hoping that may be something that can be created now with the labor being donated. Is that Fair enough?
Yeah, that's correct. We are going to be starting to put some of the material on the Circa webpage to begin with until we have the resources to build out a separate webpage. But we will be starting to put, for example, the task force report now is located on, it's circaok.com, just www.circaok.com. And so we're starting to post things there that we are gathering from different groups, but it will take some funding to post a separate webpage and maintain that. We're going to be seeking funds for the sustainability of this initiative. And we think that these are dollars well spent. So it's not something we're shy about selling.
Truth.
We often say in doing work around trauma and adversity that you can pay now or you can pay later with interest. And we see as the state, we do pay in terms of cost of putting too many people in prison and the cost of drug overdose and the cost of family violence. So we will be looking for public-private partnerships throughout the next year.
And I want to reiterate what Dr. Hayes-Grutto just said about public-private partnerships. As we all know, we're still in a pandemic. Legislatively, it's going to be a budget challenge year. I advised the group that this isn't the year to be seeking money. Unfortunately, it's not, if we may rob Peter to pay Paul again, it's just, we don't have it. So the group has been really good at trying to get a system in place so that in this public-private partnership is going to be so critical in using our resources that we have and combining them. I'm a huge proponent, have been my entire life, that we have got to quit operating in silos and protecting the money. If we're really going to reach out and wrap these services around our families that need it the most, then we've got to break those silos down and work together with our limited resources. I also believe as a legislator that we got to put policy in place before you go ask for money. And that's what this group has done. This is the groundwork for that. This year, we've got some other things that we're going to be working on. And once you have that solid base, it makes it a lot easier to go to the legislature and go, look, here's our system we have in place. Here's our plan. And this is how much it's going to cost to really do this. And here's our outcome and our measurements. And that's what's going to be critical from a legislative standpoint when we're in these budget lean years, which we're going to be for a while, as we know.
So it sounds like it's more apt that you would eventually, you'll get the kind of the Oklahoma model established in this next year based on this report. And then maybe after that, go to the legislature for money once you've shown this is what we got, this is what we can do, this is what's been working so far.
Absolutely. And I want to, we're not going to rely just on taxpayer dollars, which is what the legislature is. It's got to be a combination. Those dollars are only so small. It's a limited pot of gold that we can do legislatively. And I think that's what this task force has done so well, is creating those public-private partnerships. How can we enhance what they're doing over here at OSU with the Department of Mental Health and with our nonprofits like Parent-Child Center? So it's not just putting that burden on the state being legislatively speaking, right? It's the collectiveness of that. And I think that-
And there are federal dollars.
Yes.
Yeah, I just wanted to contribute through the National Institutes of Health, through HRSA, through the Centers for Disease Control. We are watching for every opportunity and trying to create some.
It's complicated.
Got it. Thank you.
Any other questions? Okay. Well, thank you all so much. And thank you for making this a safe place to do this in person. As a person that is a hugger and a person, boy, pandemic's been terrible to me. Very terrible. So I appreciate you all being here. Thank you.
Thank you, Representative.
Thank you.
Okay.
Glad it worked out. I'm glad it worked out.
Thank you. I am glad I was able to be there by on the screen.